Are we waiting for me to start, or are we waiting for, is there a point? That's usually for every other one, so make sure we're waiting.
Kelsey, I think we're ready whenever you are, so are you good to go?
I'm ready.
Take it away.
Good afternoon, and thank you all so much for coming for the capstone presentation. And at the end of my presentation will be the final INDS Capstone presentation, so we can all celebrate afterwards. I'm a senior, and I'll be graduating this May with a degree titled Community Health and Nutrition. I would like to start by thanking the Interdisciplinary Studies program for their unwavering support and commitment to my success. My INDS advisor, Jill Wrigley, and all of my mentors, Dr. Luis Pinette-Peralta, Dr. Esther Fleischman, and Dr. Cynthia Wagner, have made this project possible, and I am grateful for their support at each step. Lastly, I'd like to thank the Office of Undergraduate Education for funding the capstone through an undergraduate research award, and my capstone is titled Vegetable and Fruit Consumption of Students at UMBC. I'd first like to answer the question, why this capstone? This capstone, or the woman in the middle is named Sunita, and Sunita lives in a rural village in the western Himalayas, which seems like kind of a funny place to start. But the reason I mention this is she's a peer educator in her community. Her community had 100% adolescent anemia, and when I got to her village, it was the first time I saw girls that didn't have iron deficiency anemia, as reported before. And she worked with kitchen gardens and the community to address more structural issues. And that day was the day that I fell in love with community health and nutrition. And like Sunita, when I got back to the United States, I wanted to understand how I could help my peers. And I became aware of this concept of being overfed and undernourished. College students today grew up in a time where there are major changes in the dietary recommendations by the USDA. On the left-hand side, you can see the pyramid, which we grew up with as children, and today, the Choose My Plate. And as you can see at the bottom of the pyramid, it recommends mostly bread, cereals, rice, and pasta, whereas today's recommendations focus on half your plate being fruits and vegetables. And according to a 2013 systematic review of research done on nutrition in college students, they found that college students on average were only eating 1 serving of fruit and 1.5 servings of vegetables. The need for effective nutrition interventions is growing stronger as we grapple with this issue, as well as understanding the consequences of undernutrition and diet-related disease. So my goals today are to provide further background, to review the specific aims of my project, to discuss the interdisciplinary framework, and then I'll dive into the capstone itself by starting with the intervention, moving into methods, research and limitations, and I'll finish with the primary conclusions. And at the end, we'll have time for questions. Some background. The modern food system fuels the food environment we see from the market to the grocery store. From the market to school lunchrooms, which is shaped in part by the industrialized food system we have. The industrialized food system is fueled further by commodity crops such as rice, corn, wheat, and soy. And a study done in 2011 found that as production of commodity crops increased, so did the prevalence of processed food, which is high in salt, sugar, and fat in our market. Low vegetable and fruit consumption can result in undernutrition and diet-related diseases, as I mentioned before, and food choices by college students are shaped by the food environment we have here, including marketing, their access and availability, affordability, and university food policies as to what can and can't be on our campus. And according to the Centers for Disease Control and Prevention, adults ages 18 through 25, much like our students, are likely to be deficient in vitamins A, D, E, and C, as well as folate, calcium, magnesium, fiber, and potassium. Experts on the Dietary Guidelines Advisory Committee for 2015 are suggesting an even bigger push for fruits and vegetables than what we saw on Choose My Plate, which really brings my research into the context of the larger conversation about nutrient deficiencies and further USDA recommendations. Another study found that college students find it difficult to manage the preparing of their own meal and rely solely on food service provider. And at UMBC, our food service provider is Chartwell's, and meal plans range from about $16.84 to $22.89 per semester. And students living on campus must purchase that plan, or one of those plans. They're restricted to one retail meal per meal period, and there's further restrictions on weekends, holidays, and any time the campus closes early. And I wanted to find a way to help my peers at UMBC improve their nutrition by increasing vegetable and fruit intake. I had 3 specific aims of my study, and that was to assess the use of an educational intervention to increase vegetable and fruit consumption, to consider the potential social impact of gardening on vegetable and fruit consumption, and lastly, to use the results to make recommendations for behavior change interventions at UMBC. The undernutrition of the overfed on college campuses, I think, requires an interdisciplinary approach. It's a complex topic, and I use 2 integration strategies by Miller and Boyksman-Sia. Advancing through checks and balances between policy and biology, and bridging the explanation-action gap between both biology and psychology and sociology. The reason I chose to use advancing through checks and balances for policy and biology is they're crucial to understanding the context in which we live. Policy at UMBC is shaped primarily by our contract with our dining provider and what they see as feasible and possible to provide on campus, and then the biology for me to understand the nutrient deficiencies and the food that we need to have provided for our campus. Now, in terms of bridging the explanation-action gap, the concept says that one discipline provides the explanation for an issue, whereas another disciplinary perspective provides an action-oriented leverage. And I found that both biology and psychology explained how we become nutrient deficient, where nutrient deficiencies come from, and how we can treat them, and some of the issues regarding that in terms of the psychology behind it. But sociology allowed me to bridge the gap and create an intervention to address those needs. I will explain this further as I dive into the interventions I created to increase fruit and vegetable intake. So I'm going to start with the garden. A community garden on campus, imaged here. And according to social cognitive theory and sociology, when people are around others with different behaviors than themselves, they will slowly incorporate certain behaviors into their own behaviors and habits. And here in the garden, over 150 students, faculty, and staff garden together. And I wanted to understand how their interactions day to day while in the garden impacted their diet. I also created an educational guide, which should be coming around now. And it was filled with information about gardening as well as nutrition. And the nutrition component was coupled with recipes. And the recipes were divided by major food group. So it started with seeds, then legumes and grains. The bulk of the book is vegetables and fruits, and then finally nuts and further resources for the student. The vegetables are split up also by seasonality, so there's fall, spring, and summer. And the recipes were all designed to be affordable compared to the university meal plan. So each recipe costs less than $5.50 per serving. So in order to understand the impact of either of these interventions, I created my study, which started with a pre-food journal, and I asked students who participated to fill out their diet for 3 days. And then they had to circle whether it was a fruit, a vegetable, a grain, dairy, or protein, and then tell me how many helpings they had. And I used that information at the beginning. Then they were assigned to one of my 4 groups. So either they were in the garden and they received a guide, or they were just in the garden. And then if they were not in the garden at all, they received either a guide or no guide. And the reason I split them up like this is I wanted to understand if there was any additive effect between the garden and the guide. And then I also wanted to be able to separate them to see if maybe the garden was more effective or the guide was more effective, or maybe neither of them were as effective. And then at the end of the 4 weeks, the same people filled out the same food journal and totaled it up, and I compared the differences at the end. So what I found in the end is the garden, the group that got a guide and participated in the garden group was the only group that reported an increased vegetable and fruit consumption, which tells us that these results or these interventions are additive, and they didn't have as big an impact by themselves. And each group started with 6 to 7 participants, but only finished with 3 participants, which means that the conclusions can only be applied to those who participated in the study. And I find it interesting that the control group, which did not participate in the garden and did not get a guide, did not finish the study, which may have further implications about their connection to the study or their connection to a group altogether. So some preliminary conclusions are that the educational interventions and social changes are additive, and so that's important for the way that we think about nutrition interventions. We need to think about more complex and compound solutions and not try to tackle, okay, I'm going to build a garden and then leave it here and hopefully people are going to do gardening and their diet will get better. But how do we help them engage with the garden? How do we help them take what they grow in the garden and put it on their tables? And I think that was the main thing about the guide. And anecdotally, in their post-food journals, those who had the guide, I found the same recipes in the guide in their food journals. So I thought that was interesting, and further research will need to be done to understand if the guide made a difference in that way, or if that was just happen chance, as well as a larger population size will be needed. So I'd now like to open it up for questions. Yes.
Fantastic job.
Thank you.
Are you planning on having a copy of this available at the garden, since it seems like having participation in the garden and the presence of the book seem to help people with their consumption of fruits and vegetables?
Absolutely, and I'm working through the financial logistics of making that happen and seeing if it can be available to not just students in the garden, but students at UMBC at large. Thank you.
I wonder if you could put it online or laminate it and post it in the garden.
Yes.
That would reduce costs.
That would, and I would be happy to look into that. Thank you. Yes, Dr. Wagner?
Can you go back to that graph?
Yes.
Joe, you did it the same way, so it was just a 3-day follow-up after they were keeping a food journal for 3 days?
Yes, at the beginning and at the end.
And did they know when those 3 days were going to be? Like at the end?
I'm sorry, do you mean like what 3 days they picked?
Yeah.
They were asked to do 2 weekdays and 1 weekend for both pre and post.
Okay, I'm just wondering, it's kind of interesting, I mean, knowing my own dietary habits, that I sometimes eat, oftentimes very healthy, but then I have this rash of, I don't know, events that I go to and I eat junk. And I'm just wondering if, I'm wondering if we get a bigger sample size of what they eat over a longer period of time, because it's really interesting is that the garden alone group, is number 2 the garden alone?
Yes.
So they already started out pretty high, right?
They did.
And then they just went back, and I'm wondering, well, maybe they had like a few bad days there.
That's possible because it was in December, so people were getting into their finals at that point, so that could be part of it. It's also winter, so seasonality, growing in the garden was mostly over at that point, so their access to vegetables and fruit may have gone down if they were relying solely on the garden. But the 3-day food journal is used for most dietary research.
Okay.
It's developed by Dr. Gladys Block and is what's used in the N. Haynes report as well. So that's why I chose to do it. It's the standard in the field. Yes.
Can you be confident about any of your conclusions? I hear the additive piece, but it seems like the numbers are so small. What, or maybe what I should ask is, what gives you confidence that you can conclude, that you can make the conclusions that you have made from what you have?
That's a great question, and that's part of the reason I preface that my conclusions can only be made to the participants in the study. My conclusions cannot be overarching to UMBC students or to the larger campus or college population. Yes.
So I guess building on that, if you were to give advice to somebody who's going to come after you and is going to scale this up to make it statistically significant, what would be your biggest, is it simple to scale it up, or have you got any particular words of wisdom on problems that you foresee?
I think that in terms of problems that I endured were issues of timing and going around student schedules. And so timing that better with the first week of school, I think would have been a better idea. But through some delays with IRB, I wasn't able to do that. And then I also think having a group of students do it together and not having a single person, because trying to manage who got a guide and who didn't and how they filled out their pre-survey was a bit tedious for even this small population. So I think it would be best if there was a team of students working on the project. Thank you. Yes.
I have a question about contextualizing your research project with other research and interventions that you may have become aware of through literature review that you did, or just generally your being present in this field now.
Yes. So in terms of context, my study started with about the same number of participants most research in nutrition on college campus has at the beginning and end of their research. So most of the studies are very small and they target a very particular population. So I found most of the time they targeted athletes or a particular year in school. And what I found is most of them looked at one intervention. So they looked at educational interventions, or they combined, or they looked at like lecture-based, cookbook-based, different grocery store tours. And my research is the first one that I've found that looks at two intervention types and combines them. So that kind of puts us at in the field, kind of saying, how are we thinking about interventions? Are we thinking about additive effects of any of the interventions we're studying?
So, okay, two things. One, why are they all so small? So, I mean, I'm connecting that back to this earlier question about scale up, where they all seem to be quite small. I mean, I wonder if there's something to learn from the other researchers about why they're so small, and if they've tried to scale up or anything like that.
That's a really great question, and only a couple of the studies I've read discussed that in their discussion and conclusions about how they could get a larger population. And for many of the other studies, it was mostly due to the particular population they were looking at. Like they were looking at a sports team or a particular class that they were doing it in. So a lot of the research, it would be a professor and their class would be their participants. And I think that makes it a small participation size. So I'd be interested to work with them and understand better how we can increase the population size.
And I'm sorry, just my quick follow-on was,
Yes.
When you were talking about the cost of the meal plan, I wrote, if I have to have a meal plan, why should I spend more money to cook? Right, I already have to have a meal plan. So, is there a way that I can actually get the nutrients that are in the dining hall? If there are nutrients in the dining hall and they're just hiding, like it's cheaper for me if I can get those nutrients that are just hiding in the dining hall. If that's not the case, then that's not the case. But rather than me spending another $5 or whatever it is to cook a meal that I also had to go through the work of growing myself potentially, that seems like a lot of work for me to get the nutrients that I need.
That is a lot of work, and I should have preface that by saying the meal plans are either 10